Hey everyone, thanks for joining me on another episode of the Commercial Carrier Corner. I'm your host, Jared Taylor. Joining me today is the president of Premier Workforce Solutions, Nick Porter. Nick, how's it going?
Good. How are you? Thanks for having me.
Doing well. I'm excited to have you. Let's dive right in. We keep these short and sweet, and I'm excited to have a good conversation with you. First thing right out of the gate, um, if you could just share a little bit about Premier Workforce Solutions, I know our audience would like that, and then I have a couple questions I'd love to dig in with you.
Yeah, absolutely. So Premier was actually formed 5 years ago based on my history and kind of my career as a lifelong HR person. So we do a lot of HR consulting work. We do a lot of product promotion for unique concepts in the, kind of benefits HR related space. And then I've actually got the pleasure of also serving as the CEO and chair for the Post-Acute HR roundtable kind of consortium group. So we do a lot in the nursing home kind of post-acute sector from HR kind of consulting perspective.
And one of the big things I really wanted to add, because you have a interesting background, right? Because you were both a former benefits leader, now you're leading an HR consulting firm. So, what are some of the greatest challenges facing the post acute industry today, and how do health benefits fit into this equation? And you have that unique perspective, right?
Yeah.
That not many people will have. So,
Yeah. So I guess I'll start with the post-acute industry, and then we can move into healthcare because they both kind of relate to one another. But the post-acute industry, what most people don't realize is it's a very low margin, high risk business, and it's people go into the nursing home post-acute industry not to make millions and millions of dollars, but to serve. I mean, it's all about the elderly. It's all about trying to create continuity for residents and for patients, and so. The industry as a whole is a struggling industry, and it's only really been exacerbated by the staffing challenges because it is a service industry. So we're not selling necessarily a product. We are here to serve, and so recruiting, retaining is really the kind of the key to being profitable or being in business in the post acute industry. The other thing most people don't realize in the post-acute sector is your average kind of turnover rate is around 90%, which means that you turn over 90% of your entire workforce every single year. And so you're always having to recruit, you're always having to train new staff to come in. And then on top of that, you take and look at a nurse. If you kind of put the shoes of a nurse on, when you come out of nursing school, the first thing that you think is not to go and work with the elderly in a nursing home. The smells, the sounds, it's a very different environment, one that has to be a calling. You come out of nursing school wanting to go and work in an OR or work in an ED because it's exciting. And so it's, on top of struggling to recruit and retain because of the environment, you also, it's exacerbated by hospitals being able to pay more, hospitals, being able to pay themselves essentially from a health insurance perspective. And so they're able to offer better benefits. They're able to offer, better salaries. And so it's kind of a force that all comes together and makes it really, really difficult to operate and maintain a business in the nursing home industry. And so, that's what we deal with on a daily basis. And so how do we, the equation is, how do you figure out how to spend less while paying more, while offering better benefits that you don't have the benefit of having a hospital system. So it's a very, very difficult industry, specifically for human resources professionals.
you hit upon this a little bit, but I'd love to even dig deeper in terms of, what were some of the challenges you faced with traditional carriers that made you, to decide to explore other options out there?
Yeah, so I have had the unique experience. Now I'm on the consulting side, which is great and love it. I worked in a nursing home. I worked for one of the largest nursing home chains in the entire country that's still thriving today. A company called Signature Healthcare, and the Signature had 135, 140 nursing homes across multiple states, 20, 30,000 employees when I went to work for Signature, and so for me, at the time when coming into Signature, it was, that exact equation. The CFO who's interviewing me goes, Nick, we're hiring this role because we need to figure out how to increase our wages while decreasing the cost on our health plan, while at the same time making our health plan better and more affordable so that we can attract and retain. So really the most impossible equation on the face of the planet. So as I'm looking at this, at the time, Signature was with Blue Cross and Blue Shield, one of the big carriers, and they were spending hundreds of millions of dollars a year on health insurance. And so I knew really the only way that I could go and find a funding mechanism in order to kind of accommodate all of those factors was to move away from one of the big carriers and kind of control our own destiny under what's known as a reference-based pricing model.
And can you explain what that is for those that maybe are unfamiliar with it?
Yeah, reference-based pricing. Reference-based pricing can be summed up just by going, hospitals have what's known as a charge master, which most people don't realize is pretty made up. So every hospital's charge master looks way different. And so for a CT scan, one hospital may charge $3,500, one may charge $5,000, one may charge $2,000. And then you've got these things known as PPOs, which are your big carriers have gone out and formed these networks and contracts, and they've negotiated discounts with hospitals, which is great, or at least it sounds great. The problem is you're negotiating a percentage discount based upon a made up number. And so you never really know what the cost is versus what you're actually paying and whether or not it's a good deal. The best way to healthcare, really, cost of healthcare can be fixed by really understanding and it being treated like every other industry in America, which is understand what the cost is and then apply a reasonable margin on top of that. Reference-based pricing does that. Reference-based pricing takes really the global break-even point for a hospital, which the best way to know that is Medicare. So Medicare really does reimburse right at kind of break even, maybe a little bit of margin if the hospital is very efficient. And so that's what reference-based pricing does. It takes a reference, which is Medicare reimbursements, and it adds a reasonable profit margin on top of that, which for Signature at the time was we paid 20% above Medicare, which gives hospitals 20% is a great margin. Ask any business owner if they would like a 20% profit margin. And so that's what reference-based pricing essentially does. It creates transparency for health plans.
And this is sticking on health plans. How does changing a health plan help with things like recruitment, retainment, and general cost containment?
Yeah, so I was looking at that from a lens of we're benefits professionals, and the role of a benefits leader in an organization over the last 2 decades has become a budget balancing act. That is what the job is. The CFO comes to you on a yearly basis and says, hey, we've got to figure out how to make up $2 million. And so I need you to go and find $2 million in reductions somewhere in the benefits kind of realm. And so oftentimes you go to your biggest expense, which is the health plan, and you figure out how to increase copays or get rid of copays and put in place nothing but a deductible in order to kind of drive costs down, in order to meet that budget balancing act that happens on a yearly basis, which is how after 20 years, we've ended up where we are now. We've got coverage that is unaffordable. And even if you can figure out how to afford the coverage, you then can't figure out how to use it because you can't afford to use it because you have a $3,000 deductible you have to meet before the plan starts to pay. And so as benefits professionals, we've become a component of finance, and we have lost being a benefits professional. And so, when I came in, I was instantly looking at, okay, how do we shift that paradigm? Let's figure out how, instead of cutting benefits, let's figure out how to add more benefits that actually speak to a workforce that's, by the way, getting more diverse every single day. Your population is caring less and less about pensions, less and less about gold watches, less and less about retirement planning. And so how do you figure out how to offer benefits that really speak to a workforce? And so as a benefits professional, reference-based pricing gave us the ability to do that. We were able to save so much money. Signature saved $22 million a year moving to a reference-based pricing model. And we didn't do it on the backs of our stakeholders. We did it on the backs of the insurance carriers, the hospitals, and it freed up enough cash for us to be able to actually do fun things with benefits. We brought in daycare subsidies because you know what? A lot of our CNAs can't afford to come to work because daycare costs more than they're going to make in their role. We had CNAs that were taking the bus to work. So they would have to wake up 3 hours before their shift to go and serve, by the way, our elderly, and which is just insane. So we began paying for Uber rides to work for all of our CNAs that were taking buses in Atlanta, Georgia. We forgave tuition. We took over the tuition payments for all of our nurses across our entire company. And so again, those are benefits that speak to people. So my employer pays for my ride to work every single day. I have a black car pick me up every single day as a CNA to take me to go and serve the elderly, which was just something that was really rewarding for us. And reference-based pricing was the conduit to that.
Now, Nick, as healthcare costs and workforce shortages continue to increase, what advice would you give post-acute organizations that maybe are forced to explore cost-saving measures without affecting those staffing numbers?
I would encourage them to take the leap into a reference-based pricing type component. It is the single best way in order to free up cash in order to put in place a retirement match back, because everybody's frozen with them at this point. It's a way to make health insurance more affordable. Most people don't realize is, and again, this is a stat that came from Signature. Signature's running 90% turnover, but for those that are actually on our health insurance, our turnover drops to 35%. And so it's insane, just the difference between, if you can figure out how to make your coverage affordable, it actually gets people to engage and it creates a stickiness in your workforce. So, I would encourage, the stat doesn't need to be how much are we spending on health insurance. The stat needs to be, how do we get more people on the health insurance in order to create more continuity and less turnover?
I love it. Well, Nick, I want to thank you, by the way, so much for coming on, sharing some advice with us. We'll have to have you come back on in the near future to share some additional advice, but we really appreciate it. Very sound advice, and wishing you the best of luck. Thanks again for coming on.
Thank you for having me.